So thank y'all so much for having me back. I love being able to do these webinars. It's a good review for me as well to learn about these different diseases and then share that with y'all. So today I'm going to be talking about leptospirosis, and this is something that we do actually see fairly often in Texas. We have a lot of the conditions that, you know, can cause leptospirosis: flooding, rodents, wildlife, different things like that. So go ahead and. So today during the presentation, I'm going to talk about how the disease is transferred to dogs. We're mainly talking about dogs today, and they're getting leptospirosis. And then I'm going to go through kind of some clinical signs. It can vary a lot depending on what serogroup they have. But I'll go over all of that. And then we're going to talk about how we actually diagnose this disease, what kind of blood work abnormalities and maybe imaging abnormalities we might see on X-ray and ultrasound, if those are available, and then the different tests that you can run. And then I will talk about treatment. Yay, there is a very good treatment for this disease, unlike distemper. So that's encouraging that if we can diagnose it, or even maybe we can't diagnose it for sure, but we want to try to treat, then we can. And those drugs are hopefully available to y'all in India. And then, of course, I want to talk about prevention, because Dr. Dixon said, I love prevention. You know, it's much better to be able to prevent these diseases than to have to treat them, because this one, if the dog has a very severe infection, it can be very expensive to treat. And even if we do treat, sometimes if, you know, they have full-blown kidney failure, then they pass away, you know, before we can get enough treatment in them to get rid of the bacteria. So I'm going to talk a little bit about leptospirosis. So it is a bacteria, and it is gram-negative, and it is a motile spirochete, which just means it kind of like a little curly Q in shape. And so there are several serogroups. I mean, I think there was hundreds of serogroups of leptospirosis, but there's really only a few that are important in the dog. Unfortunately, the information that I found was mainly relating to the United States in these serogroups, but I'm hoping that it's similar in India. But there's canicola, and the little parentheses, the animal in the parentheses is like the reservoir host. So that's going to be the animal that kind of hosts the bacteria and is going to be spreading it to the dog. So there's canicola, where dog is the reservoir host. There's ectohemorrhagia, which is the reservoir host is the rat. Gripotyphosa, the reservoir hosts are raccoons, skunks, and marsupials. So maybe, I guess in Australia, they have, or I guess possums would be a marsupial. That I don't know if y'all have possums in India. We definitely have them here in Texas. Pomona is the cow and pig. So kind of be thinking about that if you're, you know, seeing a dog that maybe is in those rural areas where there's livestock around. Harjo is the cow. So again, that one kind of be thinking about. Ratslavia is the rat, pig, and the horse, and autumnalis is the mouse. And there, I just kind of wanted to mention that there are very few cases of clinical leptospirosis reported in a cat. The cat did not even get very sick. So I know we were mainly going to focus on dogs today, but I just want to mention that it is possible that they can get it, but they don't really spread it very well, from what I understand. And so go on. All right, so transmission. How does the dog get leptospirosis? There are several ways that a dog can get leptospirosis. I would say probably the most common cause that we share with our owners when we're talking to them about this disease would be freestanding water, or just, water that's just sitting there and it's been contaminated by the urine of one of those reservoir hosts. So like a rodent, a skunk, a possum, another dog. If it was an animal out on a farm, maybe one of those livestock animals like a pig or a cow. And then interestingly, the bacteria can live for months under the right conditions. So if it's moist and it's warm, and there's water around, then that area is going to be contaminated for a very long time. So that is, I think, why we see a lot of lepto, just because this organism can live for so long. And like I said, in Houston, we have a lot of rain and we have a lot of flooding. And so there's just literally parts of people's backyards that kind of look like this floodplain for, a week or two until it dries up. And so basically all the dog has to do is like drink that water or get its nose or its eyes kind of like, in that water, to be able to get the leptospirosis. Obviously, if there was direct contact with urine, then, I guess if somehow a dog peed on another dog or something, I don't know how exactly a dog would become in contact with the infected urine, but that's possible. Mating can cause leptospirosis transfer, and then also placental transfer. So if the mother is pregnant and has it, then she can transfer it to her puppies in the placenta. Bite wounds. So if a dog was bit by one of these wildlife creatures or another dog, or even like a rat or a mouse, ingestion of infected tissues. So that kind of goes back again to like, if the dog is, some of these dogs are just mousers, they love to go chase mice or rats, and they may catch one and eat it, and they can definitely get it that way. And then there's this indirect transmission. So that's through the water, where, the organism gets in the water from and then it just likes to stay there and multiply. And then, the animal can get it from the water. But also it said like shared food and bedding contaminated with urine. It did mention when I was doing my research that it does have to be fairly slow moving water or stagnant water. So they don't worry as much about like a fast flowing river or something like that. But more like think about like flooding, kind of like the picture there. And then kind of like I mentioned, Leptospira stays in the environment by infection of the reservoir hosts. So these reservoir hosts most of the time do not have any symptoms or any illness from lepto. So they're going to just keep spreading it and spreading it. They'll get it, it'll stay in their system, and they'll keep spreading it. And so that's kind of how it stays in the environment. So unfortunately, it's not a disease that we could really eradicate very easily. So it's kind of just going to be there. And then I did definitely want to mention the zoonotic potential of leptospirosis. That means that it can transfer to people, and people can become very sick from this disease. I actually had a kind of personal experience with this. I was at the clinic and we had a young dog come in that had a fever, was very sick, vomiting, just not wanting to really walk around much. And so of course I did my physical exam, and then I did some blood work and we collected some urine, because we typically always test the urine whenever we do blood work. And I touched the urine with my bare hands. You know, we had collected it in a little bowl and we were doing our urinalysis test with the little dipstick. And then I got the blood work back and looked at the urinalysis. And I was like, oh my goodness, I think this dog has lepto. And I had touched the urine with my bare hands. I also happened to be pregnant at the time. So I was a bit worried. And we did actually diagnose lepto in this dog. I ended up actually kind of getting on some antibiotics just to try to prevent in case I did have any transmission. I mean, if I had had like a little cut in my hand, then it's possible that I could have gotten it that way. But ever since then, I learned a very good lesson that now whenever I touch urine of dogs, I wear gloves, just so that way I don't have to worry about that anymore. So just a recommendation, if possible, when you're handling animal urine, especially of a sick animal, wear gloves. And then of course, if you did diagnose leptospirosis in a pet, you would want to be, that was at your hospital, you would want to use a lot of precautions when handling that animal, because people can get, you know, renal disease or kidney disease and things like that, and can potentially even die from this disease if it's not treated properly. I will say they do believe most transfer is from people actually in water. So there's some lakes that are contaminated with it, and so they have big signs, and so people don't go swimming in those areas, but definitely can transfer from our animals taking care of them. All right, so now I'm going to talk about pathophysiology, so basically how this bacteria affects the dogs. And so it's going to get into the bloodstream. You know, they'll have it go through their mucous membranes, like the gums or the eyes, or, you know, all those other ways that we talked about how they can get the bacteria. And then it is going to get into the blood and just multiply at a very quick pace. And that can actually kind of start causing some issues even in those blood vessels. It can attach to the lining cells of a blood vessel called the endothelial cells and cause vasculitis, which is just inflammation of the blood vessels, and even like bleeding, you know, vascular like hemorrhage, kind of like leaky vessels. And then it's going, obviously, since it's in the blood, it can kind of go wherever it wants. And typically the main organs that it affects are the kidneys and the liver. And there are some other organs that it can affect: spleen, eyes, genital tract, and the central nervous system. But by and far, kidneys and liver is really what you need to be thinking about it affecting. Those are, you know, the main ones. And then it is found in the renal tubules about 2 weeks after the dog is infected. And that's when it's actually going to be shedding it. And so that means it's like contagious to humans and other animals. And it did also, I read that the incubation period, so from the time that the dog gets the disease to where it's actually sick, is about 7 days. So you're about, you know, the dog gets exposed, a week later it's sick, and then another week it's actually shedding the bacteria. And that is important for some tests, because sometimes we can run a PCR test on either blood or urine. And if it's not shedding in the urine yet, you're going to get a negative test. So you kind of have to think about when you're testing, you know, when did this dog get sick? What should I test? Should I test the blood or the urine? Or sometimes you can just test both if, you know, the money is available to do that. So the other interesting thing about leptospirosis is that the different serogroups can actually cause different types of disease. And so Canicola, Bratislava, and Gripotyphosa are mostly going to cause renal disease. They can also cause hepatic disease or liver disease, but mainly it's going to be kidneys with those groups. And then with the ictohemorrhagia and the Pomona, it's going to be mostly the liver disease. So just kind of some good information to be thinking about, again, with, you know, testing and things like that. And this also comes into play when we're thinking about vaccinating, and but I'll get into all that later, because, you know, there's only certain serogroups that we vaccinate for. Okay, so clinical signs. What is this pet going to look like when it presents to a veterinary clinic? So in general, I mean, obviously each pet is unique, and each time it gets a disease, it can present somewhat however it wants to. But a classic case of leptospirosis, they're going to have a fever. They're going to have some vomiting and diarrhea. That may be, you know, the vomiting may be secondary to renal disease. You know, obviously dogs that have renal failure can start to vomit as well. They're going to be dehydrated. They're going to be having that fluid loss from the kidneys and the vomiting, and so they'll be dehydrated. PUPD, what that means, it just means like polyuria and polydipsia. And so that is increased drinking and increased urination and increased drinking. And again, that's just the effects from the kidney. Sometimes, obviously, in the if the dog is dehydrated, it may not be drinking, but kind of early on in the kidney failure part of it, they can have those signs. Lethargy, so they're going to be, you know, not feeling very good and lazy and just kind of laying around. Icterus, so that's like the like jaundice, the yellow of the whites of the eyes, and you kind of look at the gums and they'll be orangish color. That's from if they have the liver effects of leptospirosis, the hepatic disease, then they can have jaundice secondary to that. And then again, since the bacteria is in those blood vessels, you can have some coagulopathies, some like little petechia, which are like the little red dots on the gums, showing that like the blood is not clotting the right way. Ecchymosis is like a big bruising patch. A lot of times we see those on the belly where they don't have fur, because, you know, if they have fur all over their body, you can't see the bruising patches, but on their belly, typically they don't have fur. So you can look there for that. And then they can have blood in the urine or stool. And those coagulopathies can also be secondary to the liver disease. So if lepto gets into the liver is responsible for a lot of those clotting factors. And so if those, if the liver is really affected, then that can also be why they're having those symptoms. I kind of mentioned that it can affect the eyes. And so sometimes you can see uveitis or conjunctivitis, like the really red, swollen conjunctiva. And then in really severe cases, these dogs can be breathing heavy, rapid pulse, and basically just in shock. You know, their blood pressure is low. They're basically on death's doorstep. I did also want to mention that I've never personally seen this, but it was mentioned that sometimes lepto can affect the lungs. I guess there's some toxins that are released, and so occasionally there will be some lung changes. So that could also be why the dog may be breathing heavy. And this is kind of important. Again, the timing with lepto is important when you're trying to diagnose this disease. And basically based on, like, you know, how long ago the dog was infected and how its immune system responds, can depend on the symptoms that are shown. So there's something called per acute disease, which is just means like really rapid onset, really fast onset. And those patients are just, they don't even have a fighting chance. Basically, they get lepto in their body, and maybe they have a compromised immune system, or they're really young and their immune system is not fully developed. And so they can't even fight it off. And it just multiplies so rapidly that they just literally die with very few signs. So that is a possibility. And then really you're looking at, maybe trying to diagnose post-mortem or something like that. There's the acute disease, which is just, fairly recent onset of symptoms after being exposed. And this is kind of like the classic lepto. So you're going to have the fever, muscle pain, dehydrated, vomiting. And sometimes these dogs can still die before the renal and the liver involvement really show up. So if you have a dog that is just has a fever, and they're kind of they're not normal, they're sick, but they don't have the renal or liver, signs showing up, then you can still, be thinking about leptospirosis. I'm sorry, I did actually misspeak. So the subacute disease is the more classic leptospirosis. So that's where you're going to actually see the kidney, the kidney abnormalities on blood work, the liver abnormalities. So that's kind of the more classic. So they'll just be not feeling well. They may not always have a fever, because if they were infected earlier and maybe they had that fever, and maybe their body's kind of fighting it off a little bit, they may not have a fever when you see them. And then it did mention that there was like chronic disease, but we don't really know a whole lot about animals that have chronic leptospirosis. They typically either they're going to be treated and get better, or they're going to get so sick and go into kidney failure and die from that. There's not normally a lot of they have a mild case of lepto and just mild renal symptoms. It is possible, but we don't see that very often. Okay, so diagnosis. Obviously, when these sick pets come in, we're not going to just know right off the bat, oh yes, this is lepto, let me run a test for that. Typically, we're going to kind of work up the case. And so that would include some blood work and some imaging. And so typically on a blood work, we're going to see an elevated white blood cell count. You may see anemia or thrombocytopenia, a low platelet count, and then azotemia, so that elevated BUN and creatinine with a low urine specific gravity. In one article that I read, it said that 87 to 100% of dogs would have azotemia. Obviously, it's not 100%. I mean, this was just in this one study, but if you have a dog with azotemia, especially that's young, you want to be thinking about leptospirosis. Obviously, in an older pet, we do worry more about like chronic kidney disease or something. But in a young pet, lepto should be up there on your list. And then obviously elevated liver enzymes, if it's one of those serogroups that affects the liver. And again, some of those serogroups affect both. So if you have kidney failure and liver elevation, liver enzyme elevation, then you really want to be thinking about leptospirosis. And then again, those effects on the liver can also cause an increase in bilirubin in the blood, that hyperbilirubinemia. Radiographs, you may see some patterns in the lungs if it's, affecting the lungs. Again, I've never seen that, but it did mention that is possible. So you could maybe see an interstitial to nodular pattern in the lungs. And then ultrasound is great if you have that available. There is this something called increased cortical echogenicity. And basically there's going to be like a whiteness kind of around the cortex of the kidney. And so that's one thing that you can like look for. They also can look for pyelonephritis. And then on the liver, it said that there would be maybe like a hypoechogenicity, which is just like decreased whiteness in the liver. So it probably really looking at the kidneys, but you know, it doesn't hurt to look at the liver as well. And now we're going to talk about testing. And unfortunately, it's not super straightforward with testing for leptospirosis. The gold standard, the best test that is recommended in America right now is something called leptotiters, or this MAT test called microscopic agglutination test. And unfortunately, you can't even really just do one of them. They want something called a paired titer. And that's where you run this test once and then repeat it in 2 weeks. And so what you're detecting there is antibodies to leptospirosis. And the reason it gets a little tricky is because vaccinate for some serogroups of lepto. And if you have vaccinated recently, then that does cause you to have immune response and for your antibodies to increase. So you have to be thinking about that when you run this test. In my research, it said like a single positive titer of greater than 1/800 of a group that is not in a vaccination is very suggestive of disease. So obviously, if you haven't vaccinated for this serogroup, then it has antibodies to it, then yeah, it probably has been exposed and is having illness from that. But say it is a serogroup that you have vaccinated for, then that repeat of the test 2 to 4 weeks later, if it's just gone even higher, then that's also suggestive, because obviously if you vaccinated for it, you know, it's going to have some antibodies, but if the antibodies have had a 4-fold increase in a short amount of time, that means that the body is exposed to it and is even having a bigger response. So that can kind of be a diagnosis. And then also it just said a titer of greater than 1 to 30,000 in a vaccinated serogroup. So just like a one-time, if you get your results and it's greater than 1 to 32,000, then that can be suggestive of disease. And sometimes the titers are negative during the first 7 to 10 days. So as we talked about, you know, the dog can get infected, start showing clinical signs 7 days later, you know, say it comes in and it's like just right at that 7-day mark and you run the titer test, it could still be negative. So a little tricky there. And then there is another test called PCR, and that's actually detecting the little pieces of the virus that they've, you know, identified. And so you can do that on blood or urine. It's recommended that you do blood during that first week, because that's when the bacteria is still just in the blood. It's not really in the urine yet. That takes about 2 weeks to have the shedding. And so that's why after 10 days, or I'd say closer to 2 weeks, you'd want to test urine. If you've already given this dog antibiotics, that test could be negative. So it's just something to think about there. And then there is also kind of this neat little test called a point of care test. And that's like something that you could just do in your clinic. You don't have to send it off to a lab. The one that we have at our clinic is called this Witness Lepto test by Zoetis. And so you can draw blood, and it's again looking for antibodies. Obviously, vaccination can affect it. So if it's been it's still, you say you vaccinated 4 months ago, it's probably going to be positive anyway. But this one, if it has been longer than 4 to 6 months since you gave this dog a vaccine, or maybe this dog has never had a vaccine, and you get a positive test, then that can definitely help you in the diagnosis. And again, this is going to take a little bit of time to show up positive. If you test the dog, right at like that 7 days after it was exposed, it could still be negative just because the body hasn't had enough time to like really get a lot of antibodies in the blood yet. But I would say if you get a positive in an unvaccinated dog, then that's very likely lepto. All right, so treatment. So it is responsive to antibiotics. It is recommended, these 3 here are kind of the top recommended antibiotics. Doxycycline is what we've used to treat our patients. And we do treat for 3 weeks to eliminate the renal carrier state, because obviously we don't want these owners to get infected. We don't want their other pets to get infected. We want to get rid of that renal carrier state as much as possible. And so you can give it IV if the dog is unable to take medication. And then once it's feeling better and eating, then pill form. Or you can also do penicillin. Do those injections twice a day for 3 weeks. You can also do ampicillin IV every 8 hours for 3 weeks. Again, most of the time in these pets, when they're really sick and in the hospital, that's when we'll do the IV. Or, I mean, you could even do penicillin, IM, get it in the dog, and then maybe follow up with some oral antibiotics. The only one that orally eliminates like the renal carrier state is doxycycline. So if at all possible, I would recommend getting some doxycycline for these pets after they're feeling better, and have them take that 3-week course of it. And then obviously, if they are really sick, you're going to need to support them through the bad part of this disease. They typically need a catheter with IV fluids. You can do subcutaneous fluids if that's a possibility, just kind of put the needle underneath their skin and try to get them hydrated. If you have any anti-vomiting medication, that can really help. Pain meds, if available, having all that going on is not going to feel good. And then liver protectants could be good. So we have a product called Denamarin, which is just like a pill form, and it has a bunch of different things that are liver protectants. But there's also something called milk thistle. That's kind of more of like an over-the-counter medication that can be like a liver protectant as well. All right, so prognosis, how are these dogs going to do? Well, 80 to 90% have a survival rate with aggressive fluid therapy and antibiotics. And then also, it's going to depend on just how sick they are. If they're kind of in that chronic, or not the chronic, but the subacute phase where they just have the like liver and kidney issues, but they're not just, they're still able to eat and drink and things like that. Maybe antibiotics could, potentially cure them. They may not need that aggressive supportive care. I did mention that, again, the immune system has a big play in how these dogs are going to do. Younger dogs tend to not do as well, just because their immune systems aren't as developed as like an older dog. They think maybe even older dogs have like been exposed and gotten over it and have their own immunity, like these wild dogs, or just dogs that aren't vaccinated. It did say that if you have one of these cases where you have the lung changes, then it's pretty bad prognosis with that. And then possible complications. So they can develop, you know, kind of long-term chronic renal failure, chronic active hepatitis, up to for 50% of dogs that survive that acute phase can have impaired renal function for up to a year. In my experience, most of the pets that we've just kind of treated, and they've gotten better. And I haven't actually had any that have had these like long-term kidney issues, but I do feel like we probably catch them fairly early. So, and then of course, my favorite, prevention. So these are some vaccines that I found that may be available to you in India. Listed in the little print there are the serovars, or the serogroups that are in those vaccines. There's 3 of them there. So the ictohemorrhagia, grippotyphosa, and serohay. So there's 3 groups in there. So just kind of something to be thinking about with, like, again, if you were able to run that test, you know, which serogroups are in that, or if you were able to get one of those witness tests, you could look at exactly which serogroup antibodies it's testing for and see if it would, you know, interact with that. Yeah, so our vaccination actually include four serovars here. And, you know, I guess I don't know the exact reason why they only include 4, but, you know, I guess it's just, those are the most common ones that we see. We do see a fair amount of vaccine reactions to leptospirosis. So maybe that is another reason why they don't just, you know, include 8 serogroups to have more protection. But yeah, I would say probably 10% of the time we have animals that have a reaction to the vaccine, and that would be getting swollen face, getting hives on their body, vomiting, you know, just really, really depressed after the vaccine. And so it tends to happen in smaller dogs. We see a lot of like 10 to 20 pound dogs at our clinic. And so it just tend to be those smaller dogs. I don't see it as much in the bigger dogs with the vaccine reactions. But we actually still continue to vaccinate for them, even if they have a reaction, unless it was just very severe and, you know, they needed like a lot of care. But we just do something called a pre-medication. And you can actually even have the owner do the pre-medication before you see the pet, but they can give Benadryl, you know, an hour before orally, an hour before their vaccine, and then it'll prevent them from having the reaction. So that's pretty cool. If the owner has not given Benadryl, then we will give an injection of Benadryl and an injection of dexamethasone about 15 minutes before we give the vaccine. And then we do also keep them in our clinic for about 30 minutes after to make sure that they don't have another reaction. But again, since we see so much leptospirosis, you know, if they just had a mild reaction and just got a little bit of hives and swollen face or something, then, you know, it's still worth it to prevent that disease, just because, you know, they can acutely die. So, and then just also important, as kind of I discussed in the distemper presentation, timing of vaccines is very important. If we don't give them at the right time in the right way, then they're not going to work. So these dogs need 2 injections initially, and it needs to be about 2 to 3 weeks apart. I mean, sometimes we do them 4 weeks apart. I think that's fine, but that first one is supposed to be boosted. And then, so you give one vaccine, booster it 2 weeks to 4 weeks later, and then you would want to give that every year. There are no long extended, like, you know, vaccines, kind of like distemper, parvo, you know, sometimes people give those every 3 years. There's 3-year rabies vaccines. on all of the studies, that does not work for leptospirosis. They need that every year to be protected. All right. And now I will open it up to any questions that y'all might have. Feel free to put them in the chat box or just to unmute and ask them live.
Yeah, that's right. I think that thank you, Dr. Melissa, for a wonderful presentation. And this is a time for us to ask questions or clarification or something you want to add. That's also you're most welcome to do that. As I said in the beginning, yeah, some questions coming. From Dr. Arun, are you able to read that?
Yes, age at which first vaccination is given. So we typically do that about 12 weeks, and then booster at 16 weeks. Okay, how often would you see a case of lepto in Texas? So I am actually part-time right now, so I do feel like that kind of skews how many certain diseases, but I would say at least once a year I'm going to be seeing, a case of this, and then my associates, I would say probably more often than that, maybe once every 4 months they might be seeing a case of this. Do y'all see a lot of lepto in India?
Okay, Virat, please mute. Okay, I had to mute that person. Anybody wants to ask? I mean, you can stop sharing the screen, Melissa, so we can see each other. Dr. Melissa, you can stop sharing the screen.
Oh, yes, sorry.
Okay, this is the time for us to kind of add something, or you got anything you didn't understand, you can, you can ask questions. Whenever you want to ask directly, you can unmute, you can ask directly. You don't want to ask directly, you can put in the chat box. One question is from Dr. Rocco.
Okay.
Can you read that, Melissa? Yeah.
I had a patient who was vaccinated, at the right time, and the booster dose was also given, but 2 weeks later, the dog lepto and passed. Could it have been affected with a serovar, which was not in the vaccine? Yes, very much. I would say that would have to be the case, unless, somehow the vaccine was handled the wrong way. If it wasn't refrigerated appropriately, or the other thing that's actually important with vaccines is whenever we reconstitute them, whenever we put the liquid part with the powder part, that vaccine is really only good for about 20 to 30 minutes after doing that. So, unless the vaccine was handled inappropriately, then it was very likely another serovar. Yeah. Do you know the timing of when the vaccines were given to when the dog got leptospirosis?
Yeah.
8 week. Okay, so there's another question. Can we give the first vaccine at 8 weeks of age? Any major issues? I just never have. Again, we see those reactions, and so a young puppy is harder to treat. Even those 4 weeks difference between 8 weeks to 12 weeks, it's easier to treat an older puppy if they do have some kind of reaction. And then also the reason that we do that 12 weeks and then 16 weeks is because we want them to get their last distemper parvo vaccine at 16 weeks of age. And so that's just kind of the way our protocol is for getting them to do that last distemper parvo at 16 weeks, because the dogs are not fully protected if you stop at 12 weeks. So if, say they just came at 8 and 12 weeks and they never come back at 16 weeks, then that dog is not fully protected from distemper and parvo. And so, that's just kind of our protocol to get them to come back for that last one.
Yeah, one more question in the chat box.
Yeah, it says in Canada, we wait until 12 weeks. Okay, so they also do that there for the first vaccine. Yeah. And so sometimes we have dogs, kind of just going back into the vaccination talk, that they've already gotten their distemper parvo, like a 3-year. Would be like an older dog. It's already got its distemper year and its rabies 3-year. And sometimes they just come in for lepto and then also a bordetella vaccine. And so that's kind of the way we do it sometimes here in the United States.
Doctor, hello, can you hear me?
Yeah,
yes.
we can hear you.
Can you throw some light on the cold chain of the vaccine and what temperature it should be maintained? Regarding the cold chain.
I'm sorry, I can't understand.
Cold chain.
Dr. Dixon, do you know what?
Yeah, what Dr. Francis is asking, cold chain, how to keep the the vaccine in a refrigerator.
The vaccine.
Yeah, how we should take it to the field.
Keep it refrigerated?
Yeah.
Yeah, I mean, just coolers, I would think, and ice packs.
That's right. What's the temperature of the vaccine to be protected?
Oh, the temperature.
Yeah.
That's a really good question. I don't know, because we always just keep it in our refrigerator, which is probably at like 60-ish degrees. So I would contact the vaccine company and ask them what is the warmest that this vaccine can get to before it's no longer good. So.
And another question, can we vaccinate for the affected animals?
Okay, I would not do it at the time that the dog is sick. And then typically they are going to have antibodies, obviously, to that serogroup after they get over the illness. But they've only been typically infected with one of those serogroups. So it is still worth definitely vaccinating them. But again, you would want them to be fully recovered and healthy so that they can have a good immune response to that vaccine and be vaccinated.
Thank you, Doctor.
You're welcome. Oh, and someone commented here, refrigerator stable vaccines should be stored in the refrigerator at +2 degrees Celsius to 8 degrees Celsius or 35 to 46 degrees Fahrenheit. So I was wrong. Our refrigerator is not at 60 degrees. Yeah, typical refrigerator temperature. So thank you.
I am Dr. Paul speaking. What about the reliability of the MAT test, madam? Is it 100% reliable?
It's not, it just depends on how you're interpreting it. If it's, if you know that the dog hasn't been vaccinated and it has a really high ratio of that titer, then yeah, it's a really reliable test.
Whether we have to confirm by PCR?
But if oh, you're talking about PCR?
Yeah.
The PCR test, it says, I didn't give me any exact numbers on how sensitive it is, but yeah, I mean, I think that is a very good test. It might even be better than the titer to get like a positive test, because there's not really any false positives with that test. Because if they detect that particles of the bacteria, then it's, that's a positive. Now, it did say there's sometimes some false negatives if you've already given antibiotics.
Okay.
For the PCR
Thank you,
test.
ma'am.
You're welcome.